Our project is investigating the immunomodulatory effects of select lichen on C. elegans. Immunomodulatory drugs alter the immune system's response but can have severe side effects. Lichen is emerging as a potential alternative because they are shown to have antimicrobial and anti-cancer properties, while C. elegans, with its simple yet relevant immune system, serves as a model organism. Our research focuses on Usnea lichen, Parmelia sulcata, and Lobelia pulmonaria, aiming to identify the most effective immunomodulatory drug. Our hypothesis suggests Usnea lichen may yield the strongest immune response because of their inhibitory effect.
Moving on to our methodology, there's going to be two primary stages for our experimental preparation. The first being nematode organization, which is a way to ensure the uniform development of all of our C. elegans, as well as lichen maceration, which is a process in which we extract the bioactive compounds of lichen debris using ethanol. Then going into our setup, there's going to be 3 trials for both our 0 and 10% lichen concentrations for each of the 3 lichen types. This data will be then assessed using a motility assay, which measures the thrash count of C. elegans to determine how their movement is affected and if they obtain an increase in immune system abilities, by selecting a large number of C. elegans and counting the number of times they thrash within a 60-second period, and then finding the average for each trial.
Our data strongly supports the hypothesis. Usnea lichen outperforms other lichen species, while the 0% lichen concentration exhibits the lowest effectiveness. All the lichen fall within a healthy range, while the initial worm showed alarming levels of unhealthiness, further emphasizing the positive impact of lichen. To determine statistical significance, we conducted an ANOVA test, while t-test assessed differences in means between the lichen and control. The null hypothesis stated that the independent variables variance had no significance. However, we reject the null hypothesis as our data is statistically significant with a p-value of less than 5.5, confirming the substantial impact of lichen on immunomodulatory effects.
Ultimately, due to the positive motility activity of U. longissima, can be used as a new organic IMID, emphasizing the significance of lichen extracts in modulating immune responses, but also underscoring the need for testing and validation of natural products in biomedical research.